Hi, I'm Dr. Nichelle Gurley with Live Loud Chiropractic, and this is a what to expect video about what we're going to do in your infant pediatric session at Live Loud Chiropractic, regardless of the provider that you're seeing. First off, we're going to send you an intake form, which is helpful if you fill out ahead of time because it gives us an idea as to what we're going to be facing when you're in at our session, and it gives us an idea of further questions we want to be asking before we see you. When you come in, we're going to be talking about a greater history, understanding more about your birth, any issues you might be having with breastfeeding or bottle feeding, etc. Now, we're also going to be asking further questions about signs and symptoms you're facing so we get an idea as to what things we want to be working on with you and your child. Now, we will be observing from the minute that you've walked in, head position of baby, any skin issues that we see, is baby sucking on a pacifier, are they not, do they seem bloated, are they grunty? All those things are giving us an idea as to what's going on from the minute you walk in. But we also want to observe baby outside of your arms and outside of the car seat. So we're going to ask, once we've done the history and we've gotten a greater idea of what we're working on, is if we can hold your child. And please know that we are happy to take as many breaks as needed. We know that when we're working with infants that there's breaks that need to happen because baby's fussy, baby needs mom, baby might need to eat. So we do allow time for those moments that will happen with our babies. So when we have your baby in our arms and it's time to start working and doing our exam, we're going to be observing. We're going to look, is there any skin conditions? Is belly bloated? Are we noticing baby has a head preference? Are we noticing one leg is pulling up more than another? And then we'll do the exam in our arms. We will also observe with baby on the table, in a tummy time position on their back, because there's different things that we'll notice in that observational mode. When we're doing an exam, we're going to be checking for range of motion and any restrictions. So we like to start out just looking at general spinal range of motion, going from side to side, looking at rotation. We'll have the baby on their back and we'll look at neck range of motion, seeing if there's any restrictions there from lateral flexion to rotation. We're also going to be observing in that tummy time if there's a leg that's pulling up more than another, is that spine curving? We'll feel down and palpate baby's spine and see if there's any restrictions in this thoracic spine region or in the lumbar region. Now, another area that we really focus on is the cranium. So this is the skull right here, the cranium, and we might have heard of cranial sacral work. So we'll do a little bit of cranial work. And I just want you to see all these different colors are different cranial bones. Why this matters to us is if you look at the skull going from the bottom of your body up in, you'll see this is where the spinal cord comes in, but you'll see all these other little holes that the cranial nerves go through. Well, we have 7 cranial nerves that go towards suckling, which is going to mean that these cranial nerves and how they come out in any position of these cranial bones can impact those nerves that go towards that suckling process. So we want to make sure that all these cranial bones are where that they should be and that there is movement to them at this stage for your baby. Now up in the top here, babies have a fontanelle, which we call the open spot. And so we'll be checking out fontanelles that they have. We're going to be checking all the suture lines out and make sure that they're moving well. So when we're doing cranial work, we want to make sure that those bones are shifting and that they have movement to them and that they're not locked down, which after birth, doesn't really matter what type of birth that you've had, there can be restrictions in those cranial bones. And so our whole role as your provider is to work on any asymmetries, any imbalances, and create balance in that system so that your baby and your body can thrive. So along with those cranial bones that we're looking at restrictions or any overlap from, we want to look and check out that oral function. So we're going to go in and we're going to check out that palate, which is that yellow bone you see there. And with a glove, we'll put our glove on and we're going to feel the function of your baby's tongue. How is that baby's tongue moving? How is it going from side to side? Is it cupping my finger? Or how does that palate feel? And then we're going to get an idea of how those cheeks are also functioning with that suckle on the finger. Now, in certain circumstances, we might ask to look at how breastfeeding is going, if you mind us checking out that process just to see how baby is latching. That's not something we do in all of our sessions, but some moms will want to have us see their suckle pattern at the breast because sometimes it's different than when they're on the finger. So all in all, we're going to be looking at what history have you given us to give us an idea what's going on? We're looking at signs and symptoms that you've been facing. We're going to be observing baby in our arms, in the car seat, in your arms, on the table, both on their belly and on their back. We're going to be feeling their body for any restrictions that might be going on. And we're looking at just the overall picture. And then at the end, once we've done all of that with the oral function and looking at all of the cranial bones, we will make a treatment plan with you and decide how often we want to see your child to resolve and work towards the symptoms that you're experiencing. And we really want to have an idea in the very beginning as to what your goals are so we can base our treatment plan off of that as well. Now, we might also give you a referral, send you off to a lactation consultant for further examination. You might go to a pediatric dentist, or we might refer you back to your pediatrician. So we might be giving you some referrals in your session. And then last but not least is what we really like to give at Live Loud Chiropractic, which is home care. What can you go home and be working on? Whether it's us working on a fluid elimination to working on pelvic work that you can go home and do, different stretches or different ways and positions that you can put your baby in for breastfeeding to make that journey easier. So you'll have a really concrete idea as to what treatment plan we have for you and what rehab you can go home and do. And then any referrals, we will send those over to you. So that's just a little bit of ideas of what to expect in that infant pediatric session here with us at Live Loud.